Hi, I'm Mandy. I'm one of 3 chemotherapy nurse specialists here at the Queen's Centre. Chemotherapy is a specific anti-cancer treatment which needs to enter into the system. We can do this in many ways. Tablet form, it can be through intravenous drip. Chemotherapy can consist of a cocktail of drugs, and it will depend on the patient's circumstances and the cell type, and this will be discussed and decided with their consultant prior to agreeing treatment and consent. A patient may be having IV chemotherapy as an outpatient. They may need to go on a ward to receive treatment, or indeed they might have oral tablets where they can actually go home with a treatment. At the pre-assessment visit, a nurse will be allocated to individual patients. We will have an hour for an appointment to actually go through in detail what that chemotherapy treatment means to that patient. We'll clarify what the chemotherapy is, how it may affect them, and how we can support them through that. They'll get 24-hour contact numbers, and they will also be shown around the unit and gone into a bit more detail about their particular pathway. So when the patient first sees their doctor and agrees on the treatment plan, they will be asked to sign a consent. We will check that information with them, clarify any queries and confirm that ready for treatment. Prior to treatment, or indeed during treatment, some patients may be referred to the chemotherapy nurse specialist team for a line insertion in order to give the treatment safely. We do this service within the Queen's Centre, where they're given an appointment where we will do an assessment prior to a line. We'll take consent, we'll go through the risks. We will demonstrate what a PICC line is, how it's inserted, what it may look like, who will care for it whilst they're at the hospital, but also we will arrange referrals for the district nurse and community teams that we also train and support, so we have continuity of care. Patients will receive written information prior to any line insertion, which does have general information and very specific information and contact numbers for us, so that we can actually talk to them about any concerns before they actually come for the line. Patients will not always need to be reviewed by the doctor every time they visit. We do have nurses that will assess patients also, particularly if patients are on oral chemotherapy. We would see those and share the appointments with the doctors. We'll provide very specific information, and we can also provide extra support with telephone assessment. Cancer patients, particularly those having treatment, are more at risk from developing clots in their legs and their lungs. These may be picked up on scans, and these patients would be referred to our specialist service, again where we would be able to see the patients in a timely manner or ring them to reassure them. Of course, we're just a part of a large multidisciplinary team caring for our patients. We work very closely with their agencies and community, and if there's any other specific needs of patients around chemotherapy or other than, we will make those appropriate referrals and work closely with them.